one-page descriptions communicate critical information in ways people will read and remember. This presentation is being done by Laura Buckner. She's the program manager at the Texas Center for Disability Studies at the University of Texas at Austin. Laura has no disclosures to announce for this session. So if you will reference your screen for the CEU accreditation and disclosure statements, and then if you need more information about CEUs, you can find that on the attendee website tab. All right, you're on, Laura.
Are we ready to share screen? Okay, thank you so much, Michaela. Good afternoon, you guys. Thank you for joining me at this late hour in the day. I appreciate it. My name is Laura. I am at the University of Texas at Austin. I'm at what's called a UCED, University Center of Excellence in Developmental Disability, and I've been there for a number of years. I'm a former special educator and a licensed professional counselor, but my most important letters are my last three letters there. That's my M.O.M degree. I am the parent of David Buckner, 33 years old, diagnosed at 3 months with a rare genetic disease that, you know, I'm amazed at how far we've come in the study of the human genetic system, because 33 years ago, they couldn't tell us if we carried the gene. They didn't know which gene caused his disease. And about 15 years later, I'm happy to say we don't carry the gene. He had what was called a sporadic mutation, but he's taught me everything I know. So I have my M.O.M degree that I'll use today. And much of the work that I want to share with you today comes from a group, an international group called the Learning Community for Person-Centered Practices. So these slides are copyrighted. I couldn't put them exactly in your handout, but I put the information you need from them in your handout. These slides and these concepts and skills are being practiced all over the United States, as well as Canada, Great Britain, Africa, Australia, worldwide. And we're all about helping people get better lives, not just better paper, because, you know, we in the medical world, in the education world, Social Security world, and all these systems that our kids or ourselves live in, boy, have we created a ton of paper, but not much of it creates better lives. We're about better lives. So here's my core concept. If you get nothing more than this today, it'll be an advance in your work. The core concept is the foundation of our work is what we call important to and important for, and the balance between those two. They sound like I'm talking about the same thing, so let me explain. I'm talking about two very different things. Important to is anything, and this isn't just about people with disabilities. This is about any human being on the planet. This is about anything that helps you feel satisfied, content, fulfilled, happy, or comforted. You know, we learned a lot in this pandemic. I sometimes call it the pandemic. In the pandemic, we all lost things that were important to us, and I think it gives us more insight into the value of the things that are important to us. It's because all of a sudden with the pandemic, we weren't allowed to be with people we wanted to be with, or do things we wanted to do, or go places we wanted to go. Our rituals, our routines were disrupted. Having any level of control over whether we got COVID or whether we didn't. There for a while, we didn't have any control over that, did we? And so a lot of us learned about the importance of important to in our own lives. But for people with developmental disabilities or chronic health conditions, often important to is overlooked or lost because we get laser focused. And I can tell you this as a parent, we get laser focused no matter what your job is, whether you're the geneticist or the educator or the social worker, or whatever your role is, we get laser focused on important for, and we often overlook what's important to a person. It's even about the rhythm of life, the pace that you like to go through your day, the things you like to have, having some status, feeling like you matter somewhere, your culture, how you identify yourself, all of those things. If you're not sure, ask yourself, is this something that helps me feel satisfied, content, fulfilled, happy, or comforted? If the answer is yes, it's important to you. And important to also includes what we define as quality of life. We use that terminology like we all know what it means. But you know, COVID taught us again about how we define quality of life. Would we get a vaccine or would we not? If we had to go in the hospital, would we go on a ventilator or would we not? All of a sudden, it was very personal again. Important to also includes what people say, not just with their words, but with their behavior. Now, what do you think when people say one thing with their words and a different thing with their behavior? What do you think you should listen to? You should listen to behavior, right? Because actions speak louder than words. But you're talking to somebody with chronic health condition or disability, and words and behavior are in conflict. Pay attention to the behavior, but ask yourself, why is there a conflict? Often it's because we have taught people in these situations, we've taught them well how to tell us what they think we want to hear. So they'll say with their words what matters to them, but what their behavior says will be something very different. Because we are so laser focused on important four. That's about anything having to do with health and safety. We want to keep people healthy and safe. We want to prevent illness. We want to treat the illness. We want to promote good exercise and diet. We want to keep them safe at all times. We don't want them to take risks where they could get hurt. We don't even want them to be afraid. So we're so laser focused on important four that sometimes we miss important two. The other part of important four that sometimes we miss is what others see, the family, the medical professionals, the education professionals, the social workers, whoever, what others see is necessary to help that person be valued and be a contributing member of his or her community. My son is 33. He works at the Habitat for Humanity Restore. And he only works there part-time. He's required to wear a shirt that has Habitat for Humanity staff on it when he works. I've told the employer I need about 10 of those shirts because he wears them every day. It gives him a sense of status, doesn't it? It looks like wearing that shirt helps him be seen as a valued contributing member of the community. But it can be as simple as helping people know what the rules are when you go into a place and people are in line, or you know, what's social protocol in certain situations. Those can help people be seen as valued and contributing members. That's important four as well. And the important 2 and 4 are connected. They influence each other. And nobody, this is really important to understand, nobody, not you, not me, not our kids, not our patients, nobody does anything that's important for health and safety willingly, unless there's a connection to important 2 there. I call it the important 2 hook. Is there an important 2 hook that helps them to be interested in doing what's important for them? And that's true of all of us. If you think about it, you know, you can say all day, I need to lose 10 pounds, I need to lose 10 pounds. But if you eat something for lunch that normally, you know, that you shouldn't be eating and will not help you lose 10 pounds, and you do that every day, your words and your behavior are in conflict. But if there's an important 2 connection, maybe you're going to your high school reunion, or maybe you want to fit into a certain dress for your daughter's wedding, or maybe your blood pressure has gone off the charts and the doctor wants to put you on medication unless you can lose weight. Everybody has a different reason, but there has to be an important 2 hook for you to do what's important for you willingly. And that balance is dynamic. It's always changing, and it involves trade-offs among the things that are important to and important for. I always tell a story. I had a bike wreck about 4 years ago. I was out for a 50-mile bike ride with 2 friends, and I was the middle of 3 cyclists off the side of the road, very, very safe, wearing a good helmet, but I got hit by a truck. He never saw any of us. And you know, people used to say, well, you must ride a bike because it's important for you. It's such good cardiovascular. No, that's not why I rode my bike. It was good cardiovascular exercise. I rode my road bike because I loved it. I loved riding it. But because of that accident, I was pretty seriously injured. and had 2 joint replacements, 2 full joint replacements, had a concussion. I all of a sudden, riding my bike was not as important to me because protecting my shoulder replacement, for example, that was totally destroyed, was more important. So there's a balance, and we shift between important 2 and 4. It involves trade-offs. I've had to trade my bike in because I can't afford the risk anymore. I'm sad about that. So now it's your turn. If you're in the audience, and I'll just ask you to put it in chat where Michaela can see it. I'm going to have you practice what we call the important 2, 4 sort. Sorting information, is it important 2 or is it important 4? So here are my dogs, Coda and Willow. Coda is the border collie on the left. Willow is the golden retriever on the right. And because we live in Texas, we have to do heartworm prevention all the time, right? Heartworm is a dog disease that causes worms. A mosquito bites the dog. Worms grow in the dog's heart. If they grow too big, they'll kill the dog. But we have heartworm preventative. They have to take once a month. So let's do an important 2, 4 sort. Heartworm preventative medicine, important 2 or important 4? What do you think? Tell Michaela. Michaela, I'll ask you to fill me in. Did everybody get important 4? Okay, I don't hear anything, so I'm going to trust that everybody said important 4. Yes, it's heartworm preventative is important for my dogs. Now, Willow, when I take that box of heartworm preventative, and it's a pill about that big, when I take that box out of the pantry, Willow knows it's coming. And it says on the box it's flavored like a treat, and Willow buys it. She'll take that heartworm pill with no question. She loves it. Now, Coda, on the other hand, see the dog on the left with his eyes, how smart he is? He knows it's not a treat. He wants no part of it. You can't fool him. Let's do another important 2, 4 sort. Oh, I can see the chat. I'm going to look at it. So important 2, important 4. Peanut butter, important 2 or important 4? What do you think? You can put it in the chat. If they have the chat, I don't know if they do. I hope everybody said important 2, because yes, peanut butter is important to Coda. So let me ask you this. How's it going to work if I say, Coda, after you eat this heartworm pill, you can have this peanut butter? That's not going to work, is it? Well, I can tell you it's not going to work because I've tried it. He wants no part of the heartworm pill. And so I have to take the heartworm pill, important 4, and wrap it up in a big ball of peanut butter, important 2. We have to address what's important for people in the context of what's important to them. And so it's always in the framework of what's important to people. So let's talk about a one-page description. I call it a one-page profile on this handout, but we have since in the work I do, we've since changed the name to description because there's a little bit of a bad tone or bad feeling around the word profile. So we call it a one-page description. So what's a one-page description and why should I do one? So I gave this in your handouts. Here's a blank template. It's very boring, but it kind of shows you how it works. You put a flattering photo of the person on the form. In the top left, or what do people like and admire about this person? What's important to this person and how to best support this person would be addressing important to and important for. If we say it's important for him to manage his blood pressure, but we don't tell you how to do that. So best support is we tell you how to do that. And here are some examples of one-page descriptions. This is my son, David, and I put in white highlights the things that are really important for him at a medical appointment, because the thing about a one-page description is it has to be very focused on a specific situation or environment or setting. If you try to do a one-page description of somebody broad, general, it's too much. So I did one for David for medical appointments. This is his medical one-page description. And incredibly important are the things in white font. You can see, and I put a photo. I think it's important to use a photo that tells Photo speaks volumes about somebody without saying any words. So that photo tells you David's a driver, right? And so I put on the one-page description things that he wants to have a choice. He wants to know what to expect. He wants to be respected. He will know when you don't think he's competent. But at appointments, how do you best support him? Help me understand what you want me to do. You might have to show me. Because he has a disease that causes a lot of tumors, you can see in the picture, a lot of tumors on his face and all over his body. He would like you to ask his permission before you start looking at his face or his head and asking questions about his disease, because he's had a whole lot of doctors that were just curious about a rare disease they'd never seen before, and they would come in acting like they were there on official business, is my personal perspective, to learn about the disease. And he really resented that they never even asked him before they would start checking out his body and asking a lot of questions about his disease. So the things in white, you can see what I've written there. I want you to look at the great things about David on the top right. We always put something we like and admire about this person that tells the reader things we think they should want to know about them. We do not talk about the diagnosis here. That's already in the file multiple times. We do not talk about functioning levels here. We do not talk about disability here. We talk about personality traits, things we love, characteristics that make them a love of ours, and tell other people what they might like about them. If you're a medical professional about to meet David, you learn that he's a committed distance runner. That would be something I can tell you. He sees a nephrologist in Houston, a kidney specialist, and that's the first topic they talk about. They both wear an eye watch, and they're both runners. So they both talk about that when they're in appointments together. And David loves that. It's so much more meaningful to him. Here's another one-page description of a young man in South Dakota who has CHART syndrome, and he's both blind and deaf. His mother wrote this about him as he was preparing to go to 2 new medical appointments. And she wanted the doctors to kind of know, like you can see on best support, things that are important to Liam. It's important for Liam to know who you are by feeling your identifier and letting mom or dad introduce you. Best support, Liam uses his hands to communicate. It's important to be attentive to what he's saying, or he'll become frustrated. He uses tactile American Sign Language, feels signs with his hands. So one doctor, it went in his junk box. He never saw it. And mom said that the appointment was just disastrous. But the second doctor did see this come into his inbox, and he made sure everybody in his office, including the ladies at the registration desk, everybody saw and read this description before Liam showed up for his first appointment. And mom says it was just a dream come true. It was a night and day difference. Now, to his credit, the first doctor recognized he had missed it. He acknowledged it went in his junk box and encouraged them to come back and give him another try. But this is a way to let people know what you're going to need before you get there. This is another friend of mine, Sophie. Her mother did this for her. What we love and admire about Sophie, it's important to know she's a great sense of humor, and she loves sneezing, burping, and slapstick. So if she's sitting in your examining room and she's sneezing and burping, laugh with her. It's a great way to get started on the appointment. Sophie carries a treasured bag of photos of friends and family everywhere she goes. And so that would give you something to talk with her about and know that she's going to have it when she comes into the appointment. I love at the bottom under best support, Sophie almost always says no when asked a question. So ask her, do you mean yes, to try and see if she really means yes. And then she gives a further document on how Sophie communicates. Get her height and weight from mom. Don't force Sophie to get on a scale. A lot of this information is kept up to date by families who go to the doctors all the time with their kids, and not having to redo all those things can be really helpful. So let's ask these questions. How will you do when you're going to make a one-page description? You ask these 3 questions. Where am I going to use this? In what context? The context could be a medical appointment. The context could be the school bus. The context could be the 8th grade math class, or the school cafeteria, or the Boy Scout troop. Think about what context you want to use this in, because it will determine the information you gather for it. Second question, what do you want your readers to learn in that context? What do you want them to learn about your son, your daughter, your patient, whoever you're writing this for, in that context? And last, how is support best provided in that context? Because remember, if it's not read, not used, it's not going to be helpful. So to give you some examples in healthcare settings, and that's the context I chose for this today's session, start out with, what do people like and admire about this person? It doesn't have to be in this specific context, but do avoid functioning levels, avoid diagnosis, avoid medical jargon or social, I call it human service speak jargon. Focus on this person's personality, their gifts, their abilities, their interests, because it's a starting place for people to know who this person is outside of a diagnosis, outside of a medical appointment. Next, ask, what is important to this person at medical appointments or in healthcare settings? You know, it might be really important to a person to not have to get on the scale, or not have, some people get a little bit of a trauma trigger when they have the blood pressure cuff on their arm. I knew, I learned from my son when he was 7, he'd already had a lot of surgeries, and it was about the time he was 7, he had enough language to express himself to me what was bothering him. And I had informed him we were going to have to go and have another surgery, and was explaining what we were doing and why we were doing it. And he was just in a panic. And I said, what is it that's so scary to you about this surgery? And he said, I hate the spaceman mask. That's what they called the mask that they would put on his face to put him to sleep for surgery. Oh, I said, oh, well, let's talk to the anesthesiologist about that. And so on David's medical appointments, I let the healthcare people know that he would much rather have an injection than a mask over his face. The smell is overwhelming to him. And when the doctor came in, the anesthesiologist, I explained what David had told me. At 7 years old, he said, I hate the spaceman mask. And the anesthesiologist said, you know, David, I need to be able to put you to sleep for this surgery because I don't want you to be in pain. And the only other way I can do that is to put a needle in your arm for an IV. And David stuck his arm out like this. No words necessary. So important to David might be that he not have a mask on his face, that he have an injection instead. These are some questions that can spur your thinking, spur your processing for what you would want to put on a medical one-page description. But these questions, a lot of these questions could apply for any context you're thinking of. So what causes anxiety for this person, or discomfort or fear? What helps ease that? What helps this person feel safe in this environment? Describe how the person communicates and what supports might be helpful. Like Liam's one-page description said, he uses American Sign Language in your hand. He feels your fingers. So and knowing that and what supports around that might be helpful would be good information. How can the staff or the teacher or the bus driver, depending on your context, how can the staff prepare the person for what's coming up? You know, letting them know what we're going to do before we do it, explaining what we're doing and why we're doing it can be incredibly helpful. And letting them know how to explain that, how to prepare the person. How does this person express pain? My son has an incredibly high pain tolerance. So knowing how he expresses pain would be important. And then knowing how it's best eased or alleviated would be important to know. Are there medications that work best? Are there accommodations that are needed ahead of time or at the time of the medical appointment? And are there any other tips? These are just some starter questions to get you thinking about what kind of information you want to put on this person's one-page description. I encourage you to consider past traumas and past triggers. A lot of our kids and adults have been traumatized by some of our medical care, not by anybody's fault. I mean, my son was in an MRI machine when he was 3 months old. He doesn't remember that, but I think it could have been a trauma experience for him as a 3-month-old baby. And these people can have trauma triggers. We may not even know what they are, but if we know what traumas they've experienced or what possibly could have been traumatic for them, then we can write information in the best support about how to avoid a trigger for a possible trauma. So again, I gave you a blank template to use, but that's very boring, don't you agree? So I would encourage you to Google, or there's a link in your handouts, the link is at the bottom of this page. There's a group in the UK who has created every kind of template you can know. They have a child's page and an adult page, and their templates are available for free download. So if you like chocolate, they got a chocolate template. If you like flowers, they got a flower template. If you like pink dinosaurs, they probably got one. I don't know. But you download their free template, and then you can put the information you want to put into that one-page description that you think works best for that person. And I want to close with a video that I'm hoping will work. We'll see how this goes. You all tell me if it's working.
The ins and outs.
Is it working?
One-page profiles for healthcare settings.
I'm going to stop. Okay, I see a thumbs up. Awesome. And I can't make it large
You might
screen or
find
it will
yourself
stop
here
working.
because your child or someone you care about was diagnosed with a medical condition or even a disability. Already, there are piles of documents about that child, but those typically only focus on the medical condition, treatments, and concerns. People who love this child want their healthcare providers to know who this child is beyond that medical diagnosis. But how? Consider creating a one-page profile. Throughout this video, we'll go over what a one-page profile is, why you should create one, and how you can create one at home. A one-page profile, or a one-pager as it's also called, is a tool used to share information about someone. This profile includes important information that can be tailored for specific situations, audiences, and contexts. Now you're probably wondering, how do I create a one-pager? Before you begin, ask yourself these questions to create a focused one-pager with great intentionality. Firstly, you'll want to ask yourself, where do I want this to be used? The geneticist's office, the pediatric clinic, the children's hospital, or radiology and imaging center? In what context will this be used? Next, you'll want to ask, what do I want those in that setting or context to learn from our one-page profile? And what supports work best for the individual in this setting or context? An important place to start, regardless of context, is what you love about this child and what people admire or appreciate. Focus on their personality, gifts, abilities, and admirable traits. Avoid functioning levels, disability labels, medical conditions, or limitations. Then, think about what's important to the child in this context. What helps the child feel safe, comfortable, or happy? Maybe it's knowing what to expect before something happens, or being spoken to as the competent teenager he or she is rather than as a child. Maybe blood pressure cuffs scare the child, so using a wrist blood pressure monitor is important to the child in a medical context. Lastly, address what supports are really helpful to the child in this environment or context. If you're struggling to come up with information, here are some questions you can ask yourself that will prompt your thinking about what you want to include. For example, does something in this setting or context make this child scared or nervous? What support will ease that anxiety or discomfort? Are there communication differences to be aware of, and how are those best supported? How can staff prepare for the appointment? Are there things that could be avoided and obtained in a more comfortable setting, like a height and weight or blood pressure measurement? Are there accommodations that are helpful? And any other medication or tips that you want to share to make this as comfortable as possible? That's a lot of important details to consider when creating a one-pager. And now that you've gathered all that information, what do you do with it? Once you think you've gathered the important information, remembering to keep it brief and to the point, which helps make it easy to read, you'll put it in a template that reflects who the individual is. Sites like chefkids.co.uk provides dozens of templates that you can choose from. There's a wide range of themes, including dogs, floral, and space. Be creative and let your template reflect who your child is and what your child loves. Colors, themes, and pictures can communicate important details without words. After you've put in your information and created your one-pager, be sure to print copies to have in your go bags, your car, and other convenient locations. Most importantly, share it with the audience you wrote it for. They'll appreciate the information and your visits will go more smoothly. Don't forget to keep it up to date over the years and as you learn new important details. Here is an example of a one-page profile.
So I'm going to stop there because you've seen the examples. And let's see if I can get my PowerPoint back up. No. There it is. So I'll see if there are any questions for you, for me, from you. Michaela.
Thank you for that great presentation, Laura. We had some really great comments in the chat, just complimenting that. So
I need to stop share.
Oh, there you go. Yes. I do have a couple of questions that were put in the chat. So here we go. Is there a website where we can look at example of one-pagers to give us ideas for our own loved one?
I'm not sure of the answer of that, but I can do some research. Email me. I'll do some research and see. I know I have quite a few examples that I have permission to share, but I think the hardship is that if they're done with real people, you got to have their permission to post them. And so and the Chef Kids might, their website might have some examples, but I can't speak to that. That's a good question.
Thank you. The next question is, do you find providers may be willing to put this in the electronic medical record?
Say that again.
Do you, in your practice, have you found that providers are willing to put this in their electronic medical records?
You know, I don't know if it's in their electronic, but I'm guessing it is. They've been willing to take it. They've appreciated it, and they've been willing to put it in his file. So I assume it's in his medical records. I haven't looked for it lately. That's a good question too.
Let's see. What is the best way to get the one-pager to the provider and be sure that they see it and honor it?
That's a good question too. I would probably email it, or, you know, a lot of doctors now have patient portals, and I would see if I could upload it there and call it to their attention, but I'd probably also walk in with a hand them a copy of it.
Thank you.
You know, one thing I didn't say, but I'll say it now, be sure and keep your comments on your one-page description brief. You don't have to write in complete sentences. Don't make paragraphs, because people don't read that and they don't have time for it. So use short bulleted phrases. People are much more likely to read it and remember it.
Thank you. Another question in the chat is, has your family personally experienced pushback from medical teams with acknowledging David's one-pager?
Not to my face. But, you know, I didn't start using one-page descriptions until he was well into his late teens. And we had doctors that knew us and we had good relationships with them by then. So I can't speak, you know, I can see that it might happen if you were a younger parent with a younger child. But I think if it's a really well done one-page description that's very succinct and pinpoints critical information they can use in their appointment, most people, I think, would really appreciate it. And I would err on that side.
Thank you. Another question we have is if a family needs help making a one-pager for their family member, who could help them? Does your organization help?
No, because I can't. I'd be doing it all over the country if I offered that. There is I'm giving you a snippet of a 2-day training called Person-Centered Thinking. And that training is being done all over the US, especially since we have a new final settings rule being authorized in March of next year by the Centers for Medicaid Medicare Services. A lot of people are doing this training around the country. If you email me and tell me where you are, I could link you to somebody that's doing training in your community, and you could perhaps sign up for a 2-day training. It would go into way more detail than I could go into in my 30 minutes on important 2, important 4, and ways to discover that information.
Thank you.
Mm-hmm.
Another question is, do you think parents may need to bring the one-pager on every visit?
Doesn't hurt. Our doctors see a lot of people and they're rushed, and we all know they're juggling a lot, and I'm always impressed when they can remember something we said because they see so many people. So I would be fine with taking it in more than once. Yeah.
Thank you. Questions are rolling in. Another question is, did you use David's one-pager to transition to adult healthcare providers?
I wish I could say that I did. I did not. I did not know how to do that back then. I mean, he transitioned, a good while ago. He's 33 years old now. And I got really darn lucky because he was receiving services at the Scottish Rite Hospital in Dallas. And as he aged out of the Scottish Rite Hospital, a clinic in Houston opened for my son's diagnosis, and we moved right into it. However, I think this would be a very powerful tool for most people transitioning into adult health care, because that's another cliff that many parents are not even knowledgeable about, prepared for. They find out all of a sudden their kid can't go to this children's hospital anymore, or can't see this pediatrician anymore, and they haven't made any arrangements for any extended care into adult life. So and we know that adult healthcare providers, I hate to say this, but a study was done, so I can say it. Adult healthcare providers are sometimes hesitant to take on a patient with a developmental disability or chronic health condition, especially if it's a rare condition like my son's. And they're hesitant to take those patients on. And if you started an appointment with a one-page description that talks about how great this kid is, how great this young person is, and here's what we know about supporting them, it won't look so hard, maybe. It might be a good starting place.
Totally. Thank you. So we have about 2 minutes left. Is there any other information that you'd like to share?
Well, I would encourage you to look at that video I showed again, because it really reviews and kind of lays out the framework for how to do a one-page description. And remember, important too, anything that helps that person feel satisfied, content, fulfilled, happy, or comforted. And it doesn't have to be big stuff. It's usually the more narrow and more specific you can get. I have a hydro flask. I always use my hydro flask as an example if I were teaching this. So my hydro flask is important to me. I use it every day. I carry it everywhere I go. I have several of them, actually, and they're all in my favorite colors. But you'd have to have a conversation with me. If you just said Laura's hydro flask is important to her, you'd be skimming the surface. If you had a conversation with me, you would find out that I don't drink hot drinks. I only drink cold drinks, and I like them really, really cold. So I jam this full of ice. I can leave it in a car in 100-degree temperatures, and it'll still have ice when I come back. I love that. I'm usually going into a facility carrying all kinds of training materials. I don't have a hand for a cup, but I can carry it with this strap. Or I can, sometimes I don't have it on this one, but I have a carabiner on another one. I can hook it on my belt loop. I can put the lid down so it doesn't spill all over my clothes. I have sensitive teeth and cold hurts my teeth, so I use a straw to avoid the cold. Now you're learning what's important to me about my hydro flask. So you see how I did that? You just want to drill down to what is it about that you love? What is it about that you love? And tell me more about that. And what is it that you like about that? Get down to the detail of what's important too. I hope that's helpful.
Yes, thank you again for the wonderful presentation and this amazing tool that I think can be very helpful for many people moving forward.